few different factors are going to be affecting the distribution of different drugs. So some of those particular factors, the permeability of the tissue that the drug has to pass through, so how easily that the drug will be able to pass through the different tissues, particularly the target tissue, the blood flow to a region, because as we obviously know, a lot of your drugs are going to be carried through the circulation, the ability of the drug to bind to plasma proteins, and also the binding to the other subcellular components. So all of this is basically going to affect how much of the active ingredient of the drug will actually be able to get through the target tissue. So as drugs get distributed throughout the body, you have to understand how the cell membrane is going to influence, because obviously in order for, we talked about earlier how when the drugs attach to a receptor on a cell, it creates the action for the individual drug. It has to be able to pass through the membrane in order to do that. Your typical cell membrane consists of what's called a bimolecular layer of lipid molecules, and there are also protein molecules as well on one or possibly both sides of the membrane. Now the protein molecules will actually serve as carriers or receptors to the drugs, and the lipid molecules will permit fat-soluble molecules to pass. So the lipid layer of the drugs, or of the cells rather, are the reasons why lipid-soluble drugs will pass through cell membranes easier than water-soluble drugs. Water-soluble drugs can pass through the cell membrane. It's just more difficult for them to do that. There are three basic modes of transportation. And as far as being able to cross cell membranes, they're filtration, diffusion, and active transport. Here again, I'll have you kind of actively look in your textbook to kind of get the different characteristics of each transport mechanism. The other thing that I would like you to look at is what is the most common method that in which a drug will pass through the cell membrane. So this will take us to another portion of pharmacokinetics, our drug metabolism. So when we look at metabolism in the body, whenever we refer to that, it's basically the sum of all your body processes. So it's the movement of nutrients, its growth, its release of waste, etc. So metabolism in and of itself is a very complex process when you look at throughout the body. And as far as drugs are concerned, we look at some of the different changes that are going to occur to the drug as it's circulating throughout the body. For most of your drugs, your primary area of metabolism is going to occur at the liver, and we talked about this with the first pass effect that's going to happen with a lot of your drugs. There are some other sites where this occurs. The gastrointestinal tract and also the kidneys are other sites where drug metabolism can occur. This will happen before the bloodstream absorbs the drug. So all the drugs, as they enter the body, for instance, if you're looking at the liver and there's a little graph or a little picture of the first pass effect, will kind of show how this happens. Now, again, we look at what's the effect of exercise. As again, we're going to be typically looking at a very active population that we deal with taking a lot of these drugs. So exercise is going to decrease drug clearance throughout the body. Again, what I want you to think about this is what happens with blood flow when individuals exercise, and that should allow you to understand why drug clearance will actually decrease once exercise begins. When we look at drug metabolism, again, this will be something that will be different for all individuals, so everybody's body will kind of handle this process slightly different than others. Factors such as, disease, smoking, age are all things that are going to affect the rate of metabolism and the speed at which drugs get eliminated from the body. Again, this will be the process that will get the drug to the point where it'll be able to be eliminated from the body. Once the drug is metabolized, it will usually become more water soluble, which makes sense because at that point it will be more easily excreted from the body through the process of urination.